My name is Ashley Toski, and today, as normal, we have our County Health Officer, Dr. Andy Corn, with us to give us an update on the COVID-19 status of our county. Afterwards, we will open it up to questions from the media, and that will be followed by, if time allows, questions from the public. If you have any questions, please drop them in a comment on our Facebook page or on YouTube. And without further ado, let's move on to our update from Dr. Andy Corn.
Thank you, Ashley. So today I will start with the data as I usually do, and this is as of November 5th. Our total cases of COVID in our community have been 1,213. From the Latinx community, that adds up, it was 758 people, which is 62%. The percent of people who are, the number of people who are quarantined is 142. And those who are isolated at this time are 68. We have 3 people in the hospital. 2 are here in Mendocino. Another one is out of town. None of the people in the hospital are from the Latinx community. We have no one in the intensive care unit. And we continue to have only a death total of 21. So our case rate for this time, which is based on a 7-day lag, 7-day average, the cases were 6.71 per day. And our test positivity rate was 3.7%. So we continue to be in the red tier, which is substantial. But if you've noticed over the weeks, our numbers are increasing. And there is also cold weather. People want to be indoors. Nationally, these numbers are surging, with over 100,000 new cases a day in the last few days. That's a 50% increase over 14 days nationally, and the death toll has been 1,100 a day, which is a 15% increase according to the Johns Hopkins site. So it's having a significant effect, especially in Southern California. The test positivity, a 7-day rate is 3.4%. And again, that number is increased for California. We do not want to move that number in Mendocino. We've held it down, but it is slowly increasing. We've had some outbreaks that were controlled last month. We now have a cluster at Juvenile Hall for which we've already done outbreak testing. However, it is a congregate living situation, and those can be hotspots, so we are paying close attention to that. Our county testing and rapid contact investigation and contact tracing has been instrumental in rapidly controlling outbreaks before any major spreads. There are counties to our south that cannot keep up with the numbers they're getting due to the larger numbers of cases. And at this point, if you should test positive, expect a confidential call from our crack team that does contact investigation and contact tracing. It will be confidential. Please be open with your contacts, as it helps your friends and their families and the entire community. Again, I just want to say this is a confidential process. No one gets named on anyone's call. Testing is very important. So we've had a number of weeks here where we've been a little bit having some questions. UCSF notified us that their program will end on November 15th, since we got a short extension. We hope to have the other surveillance or screening testing available soon. We've been applying for new contracts with OptumServe to continue the site at the fairgrounds, and we have applied for other Optum service programs, which will make testing available throughout the county. So stay tuned for more. For people within 7 days of showing COVID symptoms, we have the rapid test, Binax Now, which gives results in 15 minutes, and it's free at this time. There are other rapid tests that are also available at our clinics. We are hoping everyone who has even mild symptoms will call their provider and get tested. This will rapidly help us identify anyone who has a positive test and mitigate and prevent outbreaks. The business community, chambers of commerce, lodging industry, ranchers are also planning workplace testing. And as the schools open, the staff is also going to be on a regular screening testing program. I mentioned the word last week of presenteeism. I know everybody here is dedicated who is working to go to work, both for serving their community and their business and also for their own needs. However, if you are symptomatic, if you're sick, stay home, get tested. This is not the time to break records in being present. If you are an essential worker, then even mitigate, or we can manage that, and your work will not go undone. Remember, for people who are getting down or depressed, phone number to call is our warm line, which is open Monday through Saturday from 7 a.m. to 6 p.m., 472-2311. And for questions about health orders or lab results, you can use our call center that is open from 8:30 in the morning to 5, Monday through Friday, 472-2759. I have updated some orders this past week. Close contacts will include people who are within 6 feet of a person that has COVID by test or by provider diagnosis, but it's 15 minutes cumulatively over a day, which puts us in line with what the CDPH, California Department of Public Health, has defined as a close contact. So again, it's a cumulative 15 minutes over a full day. We've also released the gatherings guideline, which includes 3 household units could come together outside using masks and social distancing between the households. Within the household, you can be closer than 6 feet, but the maximum of the gathering should be 20 people. Vulnerable people, for example, the elderly, people with chronic diseases or immune system compromised either by illness or by medicines, they should avoid these gatherings. Anyone who feels sick or has tested positive or is a close contact with someone who has tested positive, if they're quarantined or isolated, should not attend a gathering. We encourage testing within the week before, if possible, so you know if you're positive or negative. It's not 100% accurate, but it's a good guard to see if you are. This is a best practice. Playgrounds have been able to open while we're in the red tier, and our cities are currently working on staffing and safe cleaning practices. It's a challenge, but they are expected to be opening slowly over the next week. And remember to bring your masks, keep your social distancing. You may have to wait for a while until other people are in the playground, are out, so that social distancing can continue while the children play, and bring some sanitizer. As far as schools go, they should be allowed to open at the end of next week because we have been in the red tier for a full 2 weeks. School boards are drawing up plans at this time for how to transition from all distant learning model to a mixed distant plus in-person model that will gradually advance as we continue to do well. But it depends upon our doing this safely. When there are cases discovered at school, classrooms may have to be on quarantine, cohorts would be quarantined, and then the school could be closed if too many are quarantined. Even a district could be closed. So planning for safety is very key to assure a smooth transition, and the school boards are working on this, and I am working with them closely. Thanksgiving guidance should be released by the California Department of Public Health soon, but I want people to be able to plan this far in advance with some information in mind. So remember that high-risk activities include spending time within 6 feet of someone who you don't live with. Masks and ventilation outdoors using windows are good protectors. But you really want to be careful of being within 6 feet of someone indoors, that person who you don't live with. Traveling, even within the county, is traveling usually within a closed space, a car or a bus or a train. And if not a household member, make sure you have masks and open windows and stay as far apart, even in the car, as you possibly can. Shared transport traveling like planes and trains and taxis are very dangerous. It's a common place where this illness is transmitted. Everyone should be wearing a mask in those situations. And again, keep the windows open. You can't do that on an airplane, obviously, but keep the windows open and keep distance between you. And generally avoid travel if you're over 65 years old because you're at higher risk. If you're overweight, if you're a smoker, pregnant, or you have medical conditions like diabetes, heart or lung problems, cancer, or a weakened immune system from illness or medications. Or if someone is traveling with you who cannot mask, for example, young children, that would be a person who could pick up an infection and then transmit it to you or your family. Don't entertain visitors if you're sick, and ask visitors not to come to your place if they have symptoms, even if with the gathering rule. It's most important to make sure these gatherings are as safe as possible. Smaller numbers of people and eating outside are less risky. If you do travel or exposed to people without masking, consider self-quarantining for 14 days afterwards. So these are all ideas to take into mind for your holiday plans. We do want you to have a good time, but we don't want you to come back sick or leave someone sick behind you. As far as the flu vaccines, these continue to be very important. We want to avoid a twindemic with both COVID and influenza. Get these vaccines at the clinics, the pharmacies, at your primary care doctor's offices. COVID vaccine planning is ongoing at the state level. None have been approved yet, but the state is really working on developing ways to make sure that the vaccines that are approved by the FDA are safe for our citizens and they're effective, and then we get them distributed in the best possible way. So to sum up today's session, remember we're still at a point where we're cautiously optimistic. Our county did earn the red tier after a long time of being in a widespread, but we could easily fall back to purple and have to close businesses down again. So please get your flu vaccines. If you're sick, stay home from work and from any gatherings or celebrations. Wear your masks, keep your distance, sanitize, and ventilate. Outside or open windows, ventilation is a very important way to disperse these germs that travel through the air. And I'll stop now.
Thank you, Dr. Koren. And now we're going to move on to our media question and answer section of the update today. To our media, thank you so much for your patience. We had a couple of technical hiccups back there, but we should be doing a lot better now. So first, we will start off with Susan Wolbarst from the Independent Coast Observer. Just be sure to unmute.
Hello, I wasn't able to get into this meeting until very recently, so I missed most of it. So I guess I'll just pass on my questions. It's really not helpful to not be able to get into the meeting and hear the presentation, but that's what happened today.
Okay, well, if you end up having any questions later on, we'd be happy to circle back around to you. Okay, next up, we're going to go over to Sarah Reith from KZYX.
Hi, can you hear me?
Yes.
Okay, so I would like to go back to the testing issue and the work that's going into pulling together another surveillance testing program now that the relationship with UCSF is drawing to a close. I have a copy of the notice of termination from UCSF to the DOC manager canceling the free COVID-19 testing for the county. And it is from the Office of Legal Affairs at UCSF, but there's nothing in there about the cancellation being due to legal reasons on the part of UCSF. But there is an offer to continue the testing program for a fee. So it sounds like the county canceled the testing program, not UCSF. And I'm wondering if you could talk a little more about how that decision was made and who was involved in the decision-making process.
Well, the county did not cancel it. It was definitely coming directly from UCSF. And what the county has done is worked hard to extend it that extra 2 weeks. And we're working hard to replace that testing at this point.
The memo says that if the county is interested in continuing its testing with UCSF for a fee for service basis, you can reach out to Steve Miller at UCSF or Angela Constantino.
So what UCSF did cancel, Sarah, is the free testing.
Right.
So the free testing was canceled. That's what we have shared, is that we can no longer do that testing for free. The county does not have the resources to be able to pay the fees that would be required per each of those tests at this time, which is why we are looking at the partnership with the state for this testing at a much, well, the state would be covering those costs.
Right, and I have a copy of a communication from the state offering 3 different options to the county, which you've also shared. One of them is to continue supporting existing partners like clinics or physicians groups using a different lab, Perkin-Elmer, which I think is in San Jose. And so I'm wondering why the county chose to apply for the OptumServe option rather than to continue with the clinics.
It's all OptumServe. It's all through the state from the OptumServe contract, which involves the Perkin-Elmer lab. OptumServe manages the operations, and they have materials, because I don't know if you remember, but several months ago there was a lot of supply problems, and so they have the materials contracted to be provided by a third entity called Color Labs. So the state has offered several different programs to accommodate different communities, different size communities, and so on. And we've assessed that the OptumServe testing at the fairgrounds for the Ukiah area has been very successful. And in fact, we've exceeded the numbers of tests that they required early on, and we've had to use other tests for that purpose. We also know that our county is very widespread. There are sites that people can't travel to the county fairgrounds. It would take 2 or more hours, 3 hours round trip in some cases, to come and get a test. And so what we've done is we've looked at models that would allow us to offer testing in those outside areas of the county, from Point Arena up to Laytonville and Round Valley. So we are trying to make sure that the testing can go on, and probably with greater numbers as we go forward. We also want to be sure that the businesses are doing as much at the workplace, because it's not only difficult when there's distance to travel, but when people don't have the convenience to do it right outside or close by their entrance to their business. And the schools will also be testing. So we're pretty confident if the state approves our applications, that we'll be able to replace what UCSF has given us generously, but is not able to give us now. We'll be able to replace it and then improve the surveillance or screening testing that we've always offered. And so that has been our approach.
Right, but Laytonville and Round Valley already have clinics, and one of them's the Long Valley Clinic, which was already doing tests. And one of the options from the state was to continue to support existing community providers like the clinics and the physician groups. So I'm wondering why the county decided not to continue with this existing infrastructure.
So Sarah, we have had meetings with the state, and we are considering that. In fact, we are working on a revision to our application that is due today to the state, based on our conversations and clarity that we have received on some of those options that was previously putting a lot more of the work and the costs and the results that are returned through the LHJs, which is the local health jurisdictions. In those discussions, the state has revised some of their models from what was originally presented. And in that, we are working through with the clinics on how we may be able to continue this partnership that we have had with the UCSF. At this time, we can't announce that this is approved because it's entirely up to the state as to what they will approve for us. But we are making efforts to continue those partnerships.
Is there a timeline on when that would be known, or are we still expecting there to be a gap in free surveillance testing for the public?
I don't know at this time.
All right, thank you.
Ashley, you're on mute.
That was me. Sorry about that. Moving on to Jackie from El Punto. Go ahead, Jackie, whenever you're ready.
Hi, Ashley. Thank you so much for inviting me. Ricardo, could you translate for me?
Ricardo?
Por supuesto.
Ok, gracias. Tengo una pregunta. Primero, I would like to let you know that I was listening the Spanish version on YouTube, but it's in English, just to let you know. Mi primera pregunta es, en algunas otras partes del condado se han estado ofreciendo jornadas de vacunación contra la influenza gratuitas. La gente nos está preguntando cuándo va a haber esta vacuna gratis contra la influenza en el área de Ukiah. Porque sabemos que en las clínicas o en las farmacias se las pueden poner, pero alguna gente no tiene un seguro médico debido a su estatus legal.
Yes, so the question is that there has been free flu vaccines in different parts of the county. So the question is, when will these free flu vaccines will be available in Ukiah, since they are available in clinics and pharmacies, but there are people that, because of their immigration status, don't have access to health. So the question is, when will these will be accessible for the public for free, the flu vaccine?
So the county has had one flu vaccine clinic, and they're planning another 2. I don't have the exact dates or times. Oh, Becky, you want to help me with that? Thank you.
I would be happy to, Dr. Corin. We do have a walk-in or walk-up flu shot clinic scheduled for November 10th here in Ukiah at Public Health at 1120 South Dora Street. We are also going to have a drive-through flu shot clinic also at 1120 South Doris Street on November 21st. And we will make sure that that information is posted on our Facebook page and on our website for the public to see as well.
Sí, ¿entendió, Jacqueline? Ok, muchas gracias.
La siguiente pregunta es acerca de sabemos que muchas de las personas que viven en esta área regresan a sus países de origen en el mes de noviembre y de diciembre a visitar a sus familiares y amigos en sus países de origen. ¿Cuáles serían las recomendaciones para las personas que piensan viajar al extranjero?
So the question is that there are a lot of people in the Hispanic community that go back to their countries to visit friends and relatives during this season, and mostly in December. So the question would be, is there any suggestion for the people that go out to visit their families in other countries and then come back? Any suggestion you can make? Thank you.
Yes. So that's a great question. And it's not only for people who leave the country, but people who leave the county. If they go to places where they don't know whether the incidence or the prevalence of the disease is higher or lower, they're going to another community of different people. And so the recommendations that I've made is, first of all, if you're elderly, if you had medical conditions, if you're traveling with little children who cannot mask, it's going to be much more risky for you. If you're over 65, if you're overweight, a smoker, conditions like diabetes, heart or lung problems, or cancer are going to put you at more risk. So the other thing would be traveling. When you're traveling, you're in a lot of different situations that are closed spaces with other people. You want to try and avoid other people from your household as much as you can. So it may be that the taxi going down to the airport, you can have one, or the car, you have one, one family that's going. You try not to mix households in that situation. Where it may be impossible to do that, make sure the windows are wide open, everyone's masked, you're staying as far apart within a car, for example, or a bus as possible. So there's short travel and then long travel within airplanes. Of course, you're going to be going through the airport, you're going to be going onto the airplane. You want to maintain that 6 feet of distance, your masks, and then as much within the airplane. And usually the airlines have been separating the seats even more. You try and stay apart. Your families can stay together. And then while you're there, again, gatherings, if they can be smaller, and outdoors and ventilation, as well as masking, is very important. 3 concepts to go together. They really do dissipate the germs or control the spread with a mask, and they're very important. And then coming back, it is recommended to quarantine for 4 days. It's a best practice. It's not a requirement. Nobody's going to knock on your door, but you don't know if you're bringing back infection. So quarantining for as much as 14 days in your own house is a very important best practice, and I would advise people to do that. In addition, if before they leave or before they go to a gathering or a family meal, within that week, getting a test would be good. So we uncover people who might not be symptomatic, but spread it at a family gathering. And the same thing is going overseas, getting tested before, and then also you can get tested before you come back. But the quarantine period allows for any symptoms come out. Remember, you could get infected in the airport. And the next 2 days, you wouldn't have any symptoms. In fact, the next 14 days, you may have no symptoms, but you're still carrying around the infection and bringing it to other people. So that's why travel is pretty treacherous. And we, at this point in Mendocino County, have a relatively good, low rate of infectivity. So it's good to try and protect that. And traveling is an important gap in that, but I understand people have to or really want to. If you're sick, avoid the travel. If people are traveling to visit you and they're sick, ask them not to come. And that goes for overseas or even within the same county. Is that helpful?
Yes. So, Dr. Kern, for the face mask that you need to wear on an airplane or in a bus or train, is that the regular face mask, the cloth ones, or do they need like a special face mask?
What's recommended at this point is a cloth face mask. There's more protection from a medical grade mask or even an N95, which is more of a medical grade mask. But, we want people to be masked.
Thank you.
Thank you, Jackie. Now we're going to move on to Adrian from Mendo Voice. Adrian, you are on whenever you unmute.
Hi, how's it going, everyone?
Good.
Doctor, can you guys hear me?
Yes.
We can hear you.
So, Dr. Korn, I was wondering if you could comment on the small outbreak that happened at the juvenile hall that was announced yesterday. Wonder if you could provide any additional details about the severity of that and what precautions might be taken.
So we did have a report of one resident of the juvenile hall who had actually been transported in from another state. And two of the officers who transported her fell sick over the next day or so and were tested positive. So then she was tested positive. And at this point, I think we have done all of the outbreak testing, the first round. And Becky, I don't know that we have any other results, or do we? Go ahead.
This morning, we were advised that there are 3 additional staff within the juvenile hall that have tested positive. All of the individuals have been placed into quarantine, and we have been doing case investigations and contact tracing for all of these individuals, or excuse me, in isolation. And we have been doing case investigation and contact tracing for any close contacts of these individuals to place them into quarantine.
As I said in the initial report that I made, this is a congregate living situation, much like a nursing home. And so these can be very significant outbreaks. And we have actually consulted with the California Department of Public Health. So we're using the best guidance that we can possibly find. And they were very impressed that we had so quickly tested everybody as soon as we found out about this. Really was 3 cases at that point.
If I can
Sorry,
add,
Becky.
Adrian,
Yeah.
I just wanted, you had also asked about what measures are being taken.
Mhm.
I would say that the juvenile hall and under Chief Locatelli have taken extremely proactive measures to not only address that situation, but in that meeting with the state, they had significant concerns regarding the well-being of the other youth that have had contact. They've all tested negative at this point, but they are in quarantine, and they are quarantining in very close areas. And so they are ensuring that they have social distancing so that they're not having to stay in their rooms, that they are engaging in activities outside, wearing their masks, so that, you know, one of the biggest concerns has been the well-being of these youth throughout this entire situation. And additionally, they've done increased cleaning. They are making sure that their staff are wearing their masks, and the youth are wearing masks. And they are also ensuring that they are following all of the protocols that were put in place through the regular isolation and quarantine processes for not only those in the facility, as well as their staff that are coming and going from the facility. They come to work as essential workers and then go straight home to quarantine.
So just to clarify that, does that mean that who is it that is still coming in and then going home to quarantine? Who is that?
Those individuals that work in the facility that have tested negative.
That have tested negative. And again, to clarify, this child was sort of the opposite of an extradition. Their family is here in Mendocino County, and they were out of state, and they were being transported back to the county. Can you tell us what region of the country they were being transported from, if not the specific state, and by what means that transportation occurred, whether it was in a vehicle, like a vehicle owned by the county, or did they fly on an airplane to come here?
The youth was transported in a vehicle owned by the county. I do not know for sure which state. That would be a question for Chief Locatelli.
Okay, thank you. So my next question is, Dr. Korn, yesterday we saw an additional 20 cases, and I'm wondering if that was one of these sort of testing artifacts that was just a bunch of tests from a week got delivered on one day, and it doesn't actually represent a spike, or if we're looking at perhaps a beginning of, with the colder weather, a beginning of the surge that's hitting the rest of the country. The resurge.
I think that in the back of our minds, that's always in the back of our minds. We're concerned about that. Our daily positive rates have slowly crept up over the last 3 weeks, as has our percent positivity rate. But the 20 that were reported yesterday were actually tested on several days before that. So this is one of the reasons why they do we measure the test positivity rate and the case rate from a week ago, because we want those extra 3, 4, 5 days for the tests to come in. So when we count, we really wind up counting the cases from the day of the test. So the 20 yesterday, it worried me as well. And I went down to our case investigation case lead, and she brought up the numbers, and indeed, it was not just yesterday. There was a day with a large number, but it was not yesterday, and it wasn't that high. And we're still possibly in the running this week for keeping under the 49 cases per week. We're looking at that's sort of a gross number, but I think we can do it. The next few days is nice and low.
You said 49 cases for the week. Is that a specific threshold that the state sets an important threshold?
Yeah, for our size county, that would be it. But also it would exceed the 7-day average of 7 days, of 7 cases.
Okay, so and if we do hit that 49 mark this week, does that kick us back up into purple? Or I know earlier it had been said that because it's a small county and small numbers can have big impact statistically relative to the size of the county, that we might be given a little bit of leeway. We might be given a little bit of lag there in terms of being kicked up into purple.
Yeah. So we might, for example, if we did go over those numbers, we might be assigned or given a purple tier rating for that week. But it would not put us back to the purple tier until we've had 2 consecutive weeks of purple. And so we'll see what that does. The other thing is, as you said, there's an equity adjustment for counties that are less than 106,000, and they would be a little bit more lenient in terms of counting the 7-day average per 100,000 people. So they don't use that factor for the 100,000 people in the small counties.
Thank you very much, Doctor.
Thank you, Adrian. I wanted to circle back to Susan Wolbarst from the Independent Coast. Unmute if you have any questions.
Just one thing about this juvenile hall outbreak. So you had 2 officers were positive, plus the person who was transported was positive, and then you had 3 more who were positive. Is that correct? So a total of 6.
Becky, do you want to just respond to that? Because I think you know the numbers from today more than I do.
Hi, Susan, that is correct. We've had 6 positives from this incident.
Okay, and are those 6 among the 20 that were counted? 20 new cases?
So the 20 cases were one day reported yesterday. So there are some in there, but 3 of the cases we were just notified of today. So not all 6 are in there.
So is that an outbreak somewhere, or is that just random cases from all over?
The 20 cases
20.
yesterday?
Yes.
They are, at this time, we are evaluating for that and have not identified any specific outbreaks beyond the probation, the outbreak at Juvenile Hall.
Thank you.
Thank you, Susan. And now we have 2 pre-submitted questions from Matt Lefevre from KMUD and Mendo Fever. The first one asks, Dr. Koren, can you address claims regarding a changing lethality to the COVID-19 virus? Many have reported a declining lethality, and from an epidemiological perspective, does that change public health's approach towards navigating the virus?
Well, I would look at those numbers cautiously. It may be that we're having less lethality because we have better treatment. We now know more how to use things like remdesivir and steroids and other uses of the ventilators and so on. So there are more protocols that are making treatment more consistent nationwide and probably having some improved numbers. It could also be better testing and earlier care. So from our point of view, there's not going to be a change in the approach. Personal prevention and screening and testing for early mitigation and containment, the outbreak testing, the contact tracing and investigation, isolation and quarantine, all those are very necessary. Now that's not to discount that there couldn't be changes in the future, but at this point, we're seeing a significant surge in the United States, mostly in the Midwest. There are hospital deficiencies that are emerging in states in the Midwest. We do not want that to happen in California. We've seen us come close to that in Southern California in months past. But we are seeing an increase in cases in Southern California, and we've done well because of strict adherence to the recommendations. So at this point, not a significant change in our approach. We're not sure how to interpret or the reasons for this less people dying, but just to celebrate that maybe we're doing better.
Thank you, Dr. Koren. And the second question from Matt, public health has seen a significant spike in Mendocino County COVID-19 cases last night with a total of 20. Do you expect to see this as an anomaly or a trend, and why?
I hope it's an anomaly, but I want to correct. It's not 20 cases in one day that are tested in that day. So these are the numbers that are reported to us over, and the testing may go back several days. But yeah, no, I hope it's not what's going on. It could be the trend from the nation and from Southern California and other neighboring counties is an increasing rate. There's no question about that. But I don't think that 20 is an indication that boom, it's hitting here in Mendocino County. We need to keep our guard up. We need to do all the things we know how to do and we've been doing for the last 6-8 months. And hopefully we will not be as affected as some of the other people in the rest of the country are.
Okay, got it. And now we are going to go to our questions from the public. We have a couple. The first one being, at what point must public health report an outbreak to the public?
When we have defined an outbreak, we have not usually been secretive about it. But there isn't a requirement to report it to the public. If there was an outbreak, for example, in a school, the school is required to let the other people know. And we have felt that it's important that the community knows when there are outbreaks. So we've been very open about it.
Thank you.
Actually, I would just add that, throughout this pandemic, we have reported all known outbreaks to our community.
Yes, thank you. Got it. Going on to the second question. Can you use other county red tier school reopening plans as a guide for our school reopening plans instead of inventing plans just for our county?
Well, first of all, let me say that I don't write the school opening plans. Okay, that's important. The Mendocino County school districts write those plans. And yes, they're vigorously using not only what other counties have done, but groups of other counties and organizations and educators have their own best practices. No one has a huge amount of experience, but we don't want to reinvent a wheel if the wheel is rolling along fine. The problem is making sure it works for our county and our schools, and that is up to the school districts to figure out.
Thank you. And so we have one last question from the public to answer. When other California counties open up schools, have they been seeing corresponding outbreaks? And are you concerned that outbreaks when our schools open could occur here in Mendocino County?
Actually, when I've asked about this on county calls with other health officers, there have not been a lot of large school outbreaks. They tend to be small numbers, 1 and 2 here, 1 and 2 there. There are certain areas that are troublesome areas, and they tend to be buses. And when people are indoors and they're not using their masks, when they're gathering, when they're, in a smaller classroom, and when there's less ventilation. So one of the things that we are really recommending is, of course, masking, distancing, and that can be difficult within a classroom if it's a small classroom. So class sizes are going to be a little bit smaller, and more school space will be needed by increasing the number of rooms that we'll have to use, and there's a limit to that in our town. But it is a concern that we have. So the people who tend to be getting these infections also do tend to be staff. So the children may transmit a lot more. They don't tend to get as sick, but they can certainly transmit. And I would say that actually, even in the county, we have seen a few more here and there young people who have tested positive, and some who've been a little bit sick, not as sick as some of the ones we've seen in the older age groups. But yeah, it is a concern. It is a challenge we're going to have to get over. And the whole country is learning, how do we open schools? How do we open safely? And my advice is to use all of the recommendations that have come down from the California Department of Public Health, their experience with other counties, and go very slow, because we're all learning. But there is a very important reason to have these schools open. It's important for the children at very critical times of their development to be in contact with one another, and to be focused on their education and proceed with their normal growth. And that is very, very difficult when you're doing it through a computer screen.
Thank you, Dr. Koren. And if there are no other comments, we will start to wrap up our update today. All righty. So thank you to everyone who has joined us. We will be releasing a summary of this update in both English and Spanish on our Facebook pages. And our next scheduled update is going to be on Friday, November 20th. Thank you so much.
Thank you.